Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Antineoplastic medications. The client with an ovarian cancer is receiving Tamoxifen, Nolvadex. Which of the following indicates a side effect specific to this medication? Option A. Weak and brittle nails. Option B. Facial twitching. Option C. Convulsions. Option D. Constipation. Right answer is option D. Constipation. Tamoxifen, Nolvadex, is an antineoplastic medication that may increase calcium levels. Signs of hypercalcemia include constipation, abdominal pain, hypotonicity of muscle, nausea and vomiting, etc. Options A, B, and C are signs of hypocalcemia. The client with acute myelocytic leukemia is being treated with Busulfan, Myleran. The nurse specifically monitors which laboratory value while the client is taking this medication. Option A. Serum calcium. Option B. Uric acid level. Option C. Prothrombin time. Option D. Platelet count. Right answer is option B. Uric acid level. Busulfan, Myleran, is an antineoplastic medication that can cause an increased uric acid level in the body. Options A, C, and D are not related to this medication. The nurse is evaluating the medical history of a client who will be receiving Asparaginase, Elspar. The nurse contacts the healthcare provider if which of the following is noted in the history. Option A. Diabetes mellitus type 2. Option B. Pancreatitis. Option C. Asthma. Option D. Ischemic heart disease. Right answer is option B. Pancreatitis. One of the major toxicities associated with asparaginase therapy is pancreatitis. Pancreatic function tests should be performed before and during the administration of the medication. Options A, C, and D are not contraindicated with this medication. Megestrol acetate, Megace, is prescribed for a client with advanced breast cancer. The nurse reviews the client's history and contacts the physician if which of the following is documented in the client's history. Option A, pulmonary embolism. Option B, gouty arthritis. Option C, bronchial asthma. Option D, ischemic heart disease. Right answer is option A, pulmonary embolism. Megestrol acetate, Megace, is an antineoplastic agent that treats breast and endometrial cancer. This medication is contraindicated for patients with a history of thrombophlebitis and pulmonary embolism. Options B, C, and D are not contraindicated with this medication. The client with non-hodgkins lymphoma is receiving Idarubucin, Idarubucin. Which of the following would indicate to the nurse that the client is experiencing an adverse effect related to the medication? Option A, dysrhythmia. Option B, weight loss. Option C, nausea and vomiting. Option D, peripheral neuropathy. Right answer is option A, dysrhythmia. Idarubucin, Idarubucin, and Daunorubicin, Donoxome, may cause cardiotoxicity, such as dysrhythmia, fatigue, shortness of breath, cardiomyopathy and ECG changes. Option B, weight gain not weight loss is a side effect. Option C, is a usual side effect that can last for 2 to 3 days. Option D, is not a side effect related to this medication. The client is receiving cisplatin, Platinolac. Which of the following side effect is related to the medication? Option A, depressed tendon reflexes. Option B, photosensitivity. Option C, tinnitus. Option D, ptosis. Right answer is option C, tinnitus. Cisplatin, Platinolac, an alkylating medication, may cause ototoxicity, tinnitus, hypokalemia, hypomagnesemia, hypocalcemia and nephrotoxicity. Option A is a sign of hypomagnesemia. Options B and D are side effects not related to this medication. The nurse is monitoring the laboratory results of a male client receiving antineoplastic medications. The nurse plans to initiate bleeding precautions if which laboratory's value is noted. Option A. White blood cell count of 6,000/N3. Option B. Platelet count of 45,000 cells/N3. Option C. Clotting time of 8 minutes. Option D. Hemoglobin count of 15 grams/dl. Right answer is Option B. Platelet count of 45,000 cells/N3. The normal value for platelet is 1,50,000 to 4,50,000 cells/N3. When platelet count is less than 50,000 cells/N3, minor trauma can lead to episodes of prolonged bleeding. When less than 20,000 cells/N3, spontaneous and uncontrolled bleeding can occur. Option A. Normal white blood cell count is 4,000 to 11,000/N3. Option C. Normal clotting time is 8 to 15 minutes. Option D. Normal HGB is 13.5 to 17.5 grams/dl. A client is receiving methotrexate, Prometric, for a series of chemotherapy. Which of the following medication should be readily available to avoid toxicity? Option A. Mesna, Mesnex. Option B. Vigabatrin, Sabril. Option C. Leucovorin, folinic acid. Option D. Oseltamivir, Tamiflu. Right answer is Option C. Leucovorin, folinic acid. Large doses of methotrexate, Prometric, may lead to harmful effects in the body. Leucovorin is administered to prevent toxicity. Option A. Mesna is given with ifosfamide to decrease the potential of ifosfamide-induced cystitis. Option B is an anticonvulsant. Option D is an antiviral influenza medication. The nurse is providing teachings to a client receiving cyclophosphamide, Cytoxan. The nurse tells the client to which of the following. Option A. Eat foods rich in potassium. Option B. Increase fluid intake to 2 to 3 liters per day. Option C. Take the medication with food. Option D. Eat foods rich in purine. Right answer is Option B. Increase fluid intake to 2 to 3 liters per day. Cyclophosphamide can cause hemorrhagic cystitis. Encourage the client to increase their fluid intake to 2-3 liters per day, unless contraindicated. Option A. This medication can cause hyperkalemia. Option C. The medication is taken without food. Option D. Client must follow a low purine diet to alkalinize the urine and lowers the uric acid level. The nurse is caring for a client who is receiving fluorouracil, Adracil. Which of the following symptoms would necessitate the nurse to immediate discontinuation of the medication? Option A. Palmar-plantar erythrodysesthesia. Option B. Ataxia. Option C. Constipation. Option D. Insomnia. Right answer is Option B. Ataxia. During the administration of fluorouracil, monitor for symptoms of dizziness, weakness, and ataxia, which are signs of cerebral dysfunction that would immediately lead to the discontinuation of the medication. Option A is characterized by skin rash, swelling, redness, pain and/or peeling of the skin on the palms of hands and soles of feet. Usually a mild symptom that would only require reduction of the dosage. Option C. Diarrhea is a related sign, not constipation. Option D is not a related symptom of this medication. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.